This is a 51-year-old. He actually had a prostate MRI at another institution north of here, an esteemed and respected institution. But for some reason, they were not able to get a B value on the diffusion image of greater than 1,000. So the diffusion image on this case was non-complementary and not supportive of the diagnosis of cancer. So the patient had a rescan a week later. His PSA is 8.5 nanograms per ml. And let's look at his axial T2. There is a nodule in the left PZP and PZM towards the midline. It's bulging the capsule a little bit. The peripheral zone on the right is fairly dark, but non-mass-like, very ill-defined. The one on the left is more nodular and mass-like. So let's turn our attention to the diffusion image performed at 1.5 T. The original study a week earlier was performed at 1.5 Tesla. And there is an area of diffusion restriction. It's bright. We could window it very tightly, but it's not all that impressive. This is a B value of 1,200. So what I want to illustrate in this case, and let's go back a little bit to see the lower B values. Here's a lower B value. This is a B0 actually, and here is the B1200. So there is diffusion restriction in the PZM, but look at the ADC map. The ADC map is so much clearer. So when you have a situation where your diffusion images are either inconsequential or not complementary or not supportive, or there's a potential technical issue, or your B value isn't as high, the parametric images are actually the most sensitive for picking up areas of confluent, mass-like diffusion restriction, these parametric maps. And this one does so just beautifully. Now, what are some other causes for diffusion restriction failure? We've talked about them in other vignettes, but it's worth revisiting. If your spatial resolution isn't good enough, you're not going to pick up any tumors that are below 5, and if your spatial resolution is really poor, you're not going to pick up any diffusion restriction under 1 centimeter. Remember that mucinous tumors don't restrict, but they're rare. But benign, very hypercellular, benign abnormalities in the central portion of the prostate, in the TZ, these will diffusion restrict. So this is going to give you a false positive if you rely on diffusion in the central gland. But you are going to rely on diffusion very heavily in the peripheral gland. We've talked about abscesses that can give you a false positive and vanilla donut sign, as opposed to tumor, which gives you the chocolate donut sign, and that's discussed in another vignette. And then low-grade tumors, non-aggressive tumors, Gleason 6s and 5s, may not give you much diffusion restriction at all. And there are some technical factors like hyperinflation of balloon and air in the rectum that may affect your diffusion. This case illustrates just how valuable the ADC map can be. Clearly a left PZM, PZP lesion, well under 1.5 centimeters in size, illustrating a classic RADS 4 with diffusion restriction, major criteria, and supportive abnormality on the T2 weighted image as a mass. By the way, there is absolutely no diffusion restriction on the right, where we saw that charcoal-like dark crescenteric area in the peripheral zone. There it is again. In fact, it's white on the ADC map, whereas it should be black on the ADC map if it's a tumor. So the ADC map really is complementary and supportive in giving you a concrete non-diagnosis in the right gland and a positive diagnosis in the left gland.